According to the Center for Disease Control, Americans make about 500 million visits to dentists each year, spending an estimated $102 billion on dental services. In this video, you'll learn how to properly take care of your teeth and gums to prevent oral disease. Let's start with the anatomy of the mouth. Once we reach adulthood, we have a set of 32 teeth, 16 upper and 16 lower teeth, although some people with smaller jaws require the removal of the wisdom teeth. The top and bottom mirror each other, but the teeth are slightly different so that they fit together when the jaw is closed. The primary functions of the tooth are biting, tearing, grinding, and crushing. All of the teeth in your mouth have names and have slightly different functions. The molars are used for crushing and grinding food. The cuspids and bicuspids are used for tearing food, and the incisors are used for biting or cutting into food. The tooth itself is a living organ and is made up of three parts. The inner part, or root, which extends through the gum and into the jawbone and surrounds nerves and blood vessels in the tooth. The neck, which is the area between the root and the outer layer called the crown, which is the visible part of the tooth. Taking care of teeth is relatively simple and is one of the easiest, most cost-preventative measures individuals can take to ensure good health.
Teeth are very important for chewing and smiling and talking, and they're also a reflection of a person's overall health. So the healthier our teeth are, usually the better general health that we enjoy.
It's recommended that you brush and floss twice a day. Use a soft, bristled brush and buy a new one every 3 months. Not brushing the teeth can lead to food buildup in between the teeth, which can result in bad breath. Chronic bad breath is called halitosis and is often a marker for other diseases.
Bad breath could be caused by many things. It could be you have a buildup of calculus, and even though you brush your teeth still need to be professionally cleaned. It could be that some people need to brush their tongue. We all should be brushing our tongue every day. It could also be a reflection of underlying medical problem, intestinal problem, a stomach problem.
Chronic bad breath can be a symptom of gum disease. Gum disease has two phases, gingivitis and periodontitis. Gingivitis is marked by excess buildup of plaque and tartar on the teeth near the gums. In the early stages, the gums become red and swollen. Although the gums may be irritated and bleed during toothbrushing, the teeth are still firmly planted in their sockets and no irreversible bone or tissue damage will occur at this stage. Treatment of gingivitis is done at the dentist's office with a thorough cleaning. The dentist will perform a process called scaling, during which hardened tartar and plaque are removed both above and below the gum line. Gingivitis usually clears up after a professional cleaning, as long as you continue to follow a program of good oral hygiene at home. If you're consistent with your brushing and flossing, you should see the return of pink, healthy gum tissue within days or weeks. If gingivitis is left untreated, it can turn into periodontitis. Periodontal disease is a weakening of the tissues that surround and support the teeth. Periodontitis involves progressive loss of the bone around the teeth, and if left untreated, can lead to loosening and loss of teeth. Treatment of periodontitis involves root planing and cleaning under the gum margins. The purpose is to remove the bacterial colonies and irritants that cause inflammation in hopes that the disease can be eradicated. It involves the removal of plaque and inflamed soft tissue in the pockets around the tooth. The goal is that the gum will reattach itself to the tooth or will shrink enough to eliminate the pocket. Most people don't associate their mouth with any sort of disease, but recent studies have shown that the mouth can lead to several risk factors for other diseases if not properly taken care of.
Bad oral health can exacerbate underlying medical problems. So people who are diabetic and don't take care of the teeth usually can have a harder time regulating their diabetes. Women who have bad periodontal disease have a higher risk during pregnancy. And then there's studies that show that periodontal disease can increase rates of heart disease and general health risk.
Although many people fear the dentist, it's in your best interest to pay a visit at least once a year. Dentists also stress the need for children to be taught good oral hygiene, as well as seeing their dentist twice a year for professional cleaning. According to the American Dental Association, Children should see a dentist within 6 months of the eruption of the first tooth and no later than their first birthday.
Children really need to learn to brush their teeth, and they need to be routinely checked for what's called juvenile periodontitis, which is a periodontal disease that affects mostly young children. It's not a common occurrence, but they are still at risk. So to say that a child doesn't have to brush or floss because they're not going to be subject to periodontal disease is not a true statement.
When you have your dental cleaning, your dentist is also screening for many other general health concerns.
During a routine exam, we do screenings where we look for how good their hygiene is, bone loss, if they have gingivitis, periodontitis, if they have cavities, and we screen for cancer.
Oral cancer is cancer anywhere in the mouth. Oral cancer also includes cancer on the lip, tongue, inside surface of the cheeks, hard palate, or the gums. Anyone can get oral cancer, but the risk is higher if you are male, over age 40, use tobacco or alcohol, or have a history of head or neck cancer. The most common symptom of oral cancer is a mouth sore that doesn't heal. Other symptoms include white and/or red patches in the mouth or on the lips, difficulty swallowing, earaches, and any change in the way your teeth fit together, as well as persistent bleeding. If any of these symptoms last for 2 weeks or longer, they deserve a doctor's attention. The best case scenario for prevention of oral diseases is to brush, floss, and visit the dentist regularly. For more information, log on to these helpful websites